Once the patient is in the consult room, observe it in the environment. Watch it moving around the room and assess its gait, limb movement, head carriage and demeanour. All of these may give you important information about its neurological status. Start then to have a closer look at the symmetry of the head, assessing ocular position and any abnormal swellings or distortions of the normal cranial anatomy. The initial line of symmetry should be drawn down the central midline of the skull, then comparing the globe position from above the skull and also by looking at an imaginary line drawn under the globes. Once the globe position has been assessed, then a closer examination can be performed. Initially, I would perform a Schirmer tear test in all patients. The next stage is a close-up inspection of the head and eyelids. Start by inspecting the head from the nose caudally to assess for any visual abnormalities. Then have a close look at both the upper and lower lids, assessing for lid defects such as entropion or ectropion. Once this has been completed, then a hands-on approach may be taken, allowing manipulation of both the upper and lower eyelids, assessing the lid margins for distichia, impacted meibomian glands, or ectopic cilia. Once a hands-on approach is started, the patient may be difficult to assess for subtle signs of entropion or ectropion, as the patient will adjust its facial muscle tone, preventing a reliable assessment. Adnexal examination should initially be performed without topical local anaesthesia, as this may remove signs of blepharospasm and altered lid shape. The examination should be repeated following application of topical local anaesthesia where entropion is being assessed. Once the lids have been assessed, then inspection of the bulbar and palpebral conjunctiva should be undertaken. It's important to retropulse the globe and inspect the third eyelid at this stage. An inspection of the cornea and anterior chamber should then be made, assessing the corneal light reflection and the size and shape of the pupil in ambient light conditions. Once this has been carried out, then the neurological examination may begin, including assessment of the menace response, the palpebral reflex, and the vestibular ocular reflex.